All right, good morning, everyone. I think it's time to kick off this webinar for today. Just to check, can you all hear me at home? I take that as a yes. Perfect. Today we're going to deep dive a bit on social robots in healthcare. And as some of you know, we are running a webinar series during the fall where we're both focusing on aspects of the robot and the platform, but also deep diving into different industries, such as today when we're deep diving in healthcare. So I'd like to point out already now that this session will be recorded and it will be uploaded to our YouTube channel for Furhat Robotics. So if there's anyone who feels a bit uncomfortable around that, this is a good timing to opt out if you feel like you want to do that. But my name is Susanna Dillenbeck, and my role here at Furhat is to work with all our corporate clients, everything from small companies and startups to big multinational firms, and help them use Furhat in the best way possible. And with me today, I have Nils Hagberg, who is our product owner and a very good technician here at Furhat. And we, of course, also have the robot Furhat, whom you'll meet later on. And we also have a very special guest with us today, and that is Mats Berggren, director at Merck within digital business innovation and external collaboration models. And he is with us to tell us about an exciting project that we have done together with them around the topic of social robots and healthcare. So you'll meet him here later on in the webinar. And for those of you who have not met with us before, we are a social robot startup from Sweden, stemming from research at the Royal Institute of Technology here in Stockholm. And we're a group of entrepreneurs, innovators, researchers, and programmers who have a joint vision of wanting to use technology in a new way, just like we think you on the call want to do within your respective areas of expertise. And now you can probably see me also because I'm not sharing the screen anymore. So in today's session, we're going to do three main things. First of all, I'm going to give you a brief background and introduction to social robots in healthcare. That's a very broad topic, but we're going to scrape the surface on some of these exciting opportunities. Then I'm going to hand over to Nils and Furhat, who are going to show in practice some of the things that could be done. And then it's time for the star of the day, Mats, to talk a bit about in practice on the project we have done around Petra. So that will be very exciting. And we're going to save some time for a Q&A in the end, but please, if you have any questions throughout the session, just add them in the Q&A tool in Zoom, and we'll answer them as we go, or some of them we might save until the end, but don't hesitate to do that. But to begin with, let me share my screen with you again and just talk about what social robots are before we continue on to healthcare. So a social robot is commonly defined as physical robots used for social contexts, as opposed to, for example, virtual chatbots, which could be social but not physical, or physical manufacturing robots, which are physical but not social. And there can be many different shapes and forms of these. I've added some examples here on the screen, but the common denominator is that they are used in social contexts or purposes. And if we're looking at the topic of healthcare, that's of course very broad, and it can include many different aspects. And I would guess that many of you are probably thinking of situations like this one right now. How can we use robots to help the healthcare sector, which is under enormous pressure right now? And that is, of course, true. But even without COVID, there's an additional 18 million healthcare workers needed by 2030, according to WHO. And many now believe that social robots can be part of the puzzle to solve that problem. So today, we're going to take a bit more overarching view and look at three main areas of opportunities for this, which of course are related to COVID in the sense that they are all no touch and no human, and they would be applicable or available at all times, but we're taking a bit of a broader outlook. And the first one of these opportunities is screening. So using a robot's conversational capabilities to identify symptoms or indications of different diseases. The second area that we're going to talk about is social companionship. So to see if we can use robots to combat some of the loneliness issues that we see around the world. And thirdly, we're going to look at simulation. So see if we can use social robots as a tool to train and prepare medical staff for the different situations that they will face during their career. So if we're starting with screening, when we talk about this, we mean to use a robot to, for example, record medical history when you're arriving at a hospital or a clinic, maybe triage for certain symptoms or check for disease indications. And this is also where we're going to deep dive together with Mats later on. But one example of this could be to have a robot as an initial greeter in a hospital or clinic, where standard procedures such as check-in or basic questionnaires can be performed, as well as measurements such as for temperature and blood pressure. And this would, of course, save time both for medical staff and also be a safety net to avoid that infectious patients meet medical staff straight away. And it could be used, as in the sketch here, within a hospital or clinic, or based in other places in society. Another example of using screening is the dementia screener that we at Furhat have been prototyping together with the Karolinska Institute here in Stockholm, where the robot performs cognitive tests together with elderly patients to identify early signs of dementia. And we think that this is useful, or we and Karolinska think that this is useful for many different aspects. First of all, it alleviates the doctors, which are under high pressure or high workload, and it could make dementia screening available for the bigger masses. But more importantly, it also creates one standardized way of evaluating dementia, which today is done in many different ways, depending on which hospital you go to. And that could also help us with better data and better statistics. So screening is one very big area where social robots could be used. The second one, as I mentioned, was the social companionships. And we are seeing I would almost call it a pandemic of loneliness right now throughout the world, when social isolation is the key recommendation to battle COVID. And loneliness can, of course, be present in many situations, but if we look at elderly homes or geriatric departments, for example, it's been a big challenge these past months to ensure that elders do not suffer from unnecessary loneliness or isolation. And a social robot can converse in a natural way. You don't need to have any technical skills. It can ask questions, it can listen, it can provide reminders about medications, follow up on previous conversations, facilitate games or cognitive challenges. So a robot can, in other words, both be used as a tool for cognitive stimulation and make time go by a bit faster, but also as a means of providing comfort and a sense of feeling listened to. And lastly, we talked about simulation as a way to train medical staff. So this is a bit of a different angle on how robots could help in healthcare, but this is a way to help medical staff to practice their skills together with a robot that is simulating different patients or situations before they go out in the real world, so to say. And one example of this is the researcher Robert Johansson, who is doing research on the Furhat robot to train psychiatry students and prepare them for real therapeutic situations. So the robot enacts patients with different symptoms that the students get to practice on in a safe environment before moving on to real patients. And this picture that you see here, it's actually from one of these sessions where the robot enacts a depressed patient. And some of you may be thinking now, why a physical robot? Why not just use an iPad or a smart speaker? And that's a good question. But if we start with an iPad, that actually requires some basic knowledge on how to use a touchscreen. It requires the ability to read, um, and it also means that many different people will touch the same screen or surface, which is not optimal right now. So, if we at least think about the hospital or screening situation, we don't think that that is optimal because if you are elderly, for example, we cannot assume that every elder knows how to use a touchscreen or still has the possibility to read. But what about a smart speaker then? That should, in practice, work. And for sure, it does in many situations. But talking about one's health is quite private. So wouldn't you rather do that with an interface that can look you in the eyes and show emotions and connect with you in a human like way? Especially if we're talking about these situations with the simulation and training staff or the social companionship. So we strongly believe, as does the market now, that there are many important use cases where the social aspects and the physical aspects of a robot are key. And lastly, before I hand over to Nils, many of you might be thinking, robots, healthcare, why isn't Susanna talking about, these fantastic robots that work in hospitals throughout the world and disinfect hospital wards or rooms? And that is a truly amazing use of the new technology. But we at Furhat, we don't think that the social aspect to these robots are that important. So hence why we don't see that our robot who excels in the social aspects would be a good thing to use in these cases. There we can rather aim for the more industrial versions. So this was just a short introduction to spark your ideas and imaginations on some of the things that can be done with social robots and healthcare. But of course, the topic is very broad. But I think it's time for me to stop talking and actually hand over the mic and the video to Nils and Furhat to look a bit in practice on this. So let me stop sharing and go on.
All right, thank you so much, Susanna. So I would go on and talk about these three use cases: the screening, the companion, and the simulation. And I will also show a little bit how that can look like on the robot. So we start with the screening. They can range from very straightforward form filling type of interactions to much more advanced dialogues that might have additional sensors and do fairly complex screenings and prognosis. And even the straightforward form filling interaction, it can be a more fixed questions, the same questions to everyone, to anyone, or it can be these more complex decision trees. Or it can even be that you can connect to an API, to a backend, and that could be the same backend as you have on your website or in an app. And you really have the flexibility in the SDK when working with the robot to choose the path that makes more sense for you. And maybe starting with a more simple one and moving to a more complex interaction. And I would like to start with showing you an example of this using Petra that Mats will be talking a little bit more about later on. And Petra is designed not just a skill, but the whole environment around it. What I'll be showing you today is just the robot and interaction. I put a screen here in front of the robot because the Petra interaction utilizes a screen as well. So you have to imagine this being in a supermarket or a shopping mall or a pharmacy, and a more private environment that's been built around the robot. Right now, Petra can't see me because I blocked her camera. So when I remove the blindfold, she will see me and she will start interaction. So let's go.
Welcome, I'm Petra, Merck's pre-screening robot.
Hi there.
I'm here to help you check if you are at risk of developing diabetes. First, can I tell you a bit about why this is important?
No, let's skip that.
Okay. Then we will skip directly to the questions. Let's get started. In this screening, I will ask you questions about your health and score you on the risk of developing type 2 diabetes. All your answers will be deleted right after the screening is finished. And remember, I'm not a doctor, so the results will only be an indicator. Do you understand?
Yes, I understand.
Okay. Have you already been diagnosed with diabetes?
No,
Understood. Are you male or female?
male.
Got it. Next question. How old are you?
I'm 34.
Uh-huh. So, how tall are you in centimeters?
Let's actually, we can switch to another language.
No problem.
Ich hoffe, das klingt besser. Also, wie groß sind Sie in Zentimetern?
I think I will stop her there.
Ich konnte Sie nicht verstehen. Könnten Sie das bitte wiederholen?
I think she will go back to sleep when she can't see me anymore. So as you see there, also I was able to switch language, which can be a very neat feature when creating these screenings. Although ideally you would change language maybe in the beginning of the interaction, not here in the middle. And if you do so, then you can do it with voice. It's also possible to do more complex dialogues. So let's look at another example. So I will stop Petra here and start another little interaction. We can actually remove this. So let's try this one.
I will ask you to count backwards from 100 in steps of 7. So 100, 93, and so on. Do you understand?
Yeah, sure.
Good. Please start now.
93, 86, 79, 72, 65, 58, 51.
Thank you. We reached 44. Let's move on.
Actually, you can go back to sleep.
Okay.
So that was just a very simple example of a little bit more complex interaction that is not just simple form filling. And you can imagine this being used in a screening to test your cognitive abilities. This is still just using dialogue and interaction. The robot has a camera, and you can use the camera as a sensor. And in the SDK, when you're working with the robot, you get access to the raw video stream. So you can pipe the video stream to another computer where you can do this more complex analysis of the user. For example, measuring my respiratory rate, my heart rate, etc. All this can be done just from a camera stream. There are lots of new technologies being advanced in just the recent 2 years. So there are a lot of open source libraries for anyone to start using. And it is also possible to connect other hardware to the robot. Just the simple one, maybe like a pressure plate that I would stand on so the robot will know my weight. Or the more advanced ones. It could be an iris scanner or an infrared camera or whatever that can be important to facilitate the screening, the more advanced screening, I would say then. So this is a little bit on technical side, the different or the possible integrations and technology that you can use together with the robot to do a very powerful interaction and screening. If you talk about other use cases, for example, the companion use case, that's much more focused on the social element and the robot. And the main feature here is the social and conversational intelligence of the robot. That really merits its own webinar and a 15-minute presentation for me to show you that. But at least I can show you a little bit example of that, what that could look like. So let's try that.
You have to put on my other mask. Let me know when we
Yes.
can continue.
Let's do that.
Is it on? It's very dark.
Not yet. I'll try to put this one on as well.
Is it on? It's very dark.
This is a little bit difficult with one hand.
Is it on? It's very dark.
Let's keep it. Yes, it's on.
Okay.
Hi there, I'm Philip. Grown-ups can be scary sometimes. It can be easier to talk to me instead. Or what do you think?
Yeah, I agree. Sometimes it's easier to talk to a child or a robot.
But it's always good to have something to talk about. Or to play a game together.
You're absolutely right. So whenever building these companion robots, it's always easier if you have a task that you can do with the robot. So this is obviously a very, very, very little short example. In the last use case, for the simulation, the main feature that you would use in the robot here, oh, sorry, let me put the adult mask back on, is the natural appearance of the robot and the expressiveness and customizability of the robot. So you can create characters. So let's look at another character.
Hi there. My name is Max Henderson. Nice to meet you all. You have to excuse me. Sometimes I struggle to find the right words. What were we talking about again?
That's okay, Max. You can go back to sleep. Let me actually put you to sleep here. So these examples are something I created, last night to do this presentation here today. So you can imagine the kind of thing you can do if you put a week's work or 2 weeks work or a couple of months work into these characters and into these interactions. So there's a lot to explore, and we're very keen to find partners to explore this and partners who have good and deep knowledge about the specific use case within the different aspects of healthcare. And that's where we are very happy to have this collaboration with Merck for the medical screening for diabetes. And I think with those words, I think that's a good segue to hand it back to Susanna and Mats.
Super. Thanks, Niels. I'm going to ask you to mute yourself as well. So I'm very soon going to hand over to Mats. I thought I would just answer a question first that popped up in our tool, and that is whether we have tested to use the robot out in the wild with elderly and what their reaction is to it, whether they accept it or like it, etc. And the quick answer is yes, we have tested it, for example, as part of this dementia project or screening project that I mentioned, and also in other aspects. It works overall well for them to interact with the robot. I think for some of them, we have seen that there is a little bit of hesitation initially to see this new interface, and is it okay to just talk as a human, or is there any other skills needed? So a bit of initial hesitation and perhaps encouragement needed. But after it has been understood that you can talk just as you would to a person, that has overall worked out very well. So we see a positive trend there, but of course these are initial tests that have been done, and more could definitely be done in the future, and we're looking forward to that. But good question, keep them coming. In the meantime, I think it's time to hand over to Mats. As I mentioned in the beginning, he's working at Merck, and his role there is to be a link between Merck and the healthcare sector, translating solutions to global human challenges with different partners, finding new solutions, new products, and new partnerships. And he's going to tell you a bit more about that. So I can't welcome him up on stage, but I can ask him to at least unmute himself. That's the new times that we're living in. And I'll hand over the video and the mic to you, Mats, and I'll share my screen here in the background with a few pictures.
Excellent. Thanks a lot, Susanna, for that introduction. And also thank you, Niels, for a fantastic voyage through social robotics and healthcare. First, a few short words about Merck. We are a global science and technology company. And basically, we believe that science and technology is a force for good to solve major human challenges. And we do that in three different business divisions. One is the healthcare division, where we develop pharmaceuticals. We also do laboratory equipment and testing, which plays, of course, a very important role now in fighting the COVID epidemic. And we also create special electronics also to make the screens come alive basically everywhere where we see. But basically our work with Furhat Robotics started in that we were interested to see how can we sort of combine, how can we combine the power of new technology to solve existing big medical and human problems. And for instance, Susanna and Niels mentioned diabetes, but also pre-diabetes, the stage before actually getting a diagnosis. And this is due to basically a low awareness, but also on the types of lifestyles that we are having. So we were sort of seeing how can we find innovative ways to bridge this chasm and basically move and nudge people into healthier lifestyles and getting help for those that need it. And so basically that was our starting point, and that's where we saw that how can we use new technologies that is very innovative in this, that is not some sort of campaign on the internet or in magazines and so on. And there we sort of met Furhat Robotics, and sort of in my job I run a global digital business innovation lab. So we sort of started with this problem of how to sort of meet helping people get access to treatment. And we started by basically testing the technology, as someone here said. So does it work in the live? So we started in the semi-wild. So we tested Petra in different locations around the world, both within our own sort of network in Ireland, Italy, and so on. And then we created also an MVP that we tried out for the pre-diabetes functionality. What you see here on the image is where we built up a screening station as an MVP at the world's largest pre-diabetes conference in Korea last year. And that was to sort of test this in the semi-wild. Before that, we had a number of tests in Stockholm. We had tests in Germany, where we have our global headquarters, and so on. So, and then we have now also progressed to a stage where we are looking at the launching this pre-diabetes screener in collaboration with one of the world's or the largest pharmacy chains in Mexico, where pre-diabetes is a huge problem. And the challenge here is that all the people that have this, within 5 years, 20% convert into having diabetes, which is chronic. So there are huge human but also societal benefits in preventing this disease from happening. And then to do that, you need to assess the risk for that. So basically, we learned through our different experiments that the Furhat technology is engaging. It creates curiosity and sort of moves people in. And then we could combine this with verified screening sets and questionnaires to create a very unique, personalized, and very humanesque experience, and then to guide people in to healthcare. So basically, in summary, we together with Furhat Robotics, we have created a new entry door to the healthcare system that enables more people to get help. And then from now on, I believe the possibilities are endless. I mean, Niels alluded to different types of technologies and sensors you can add to this. That is one thing, but you can also put this into different settings in the society. We will start with first in pharmacies, but you can imagine other places where this could be possible as well. And then you could link into online doctors to get immediate feedback from a medical profession. So it's fantastic. So basically, we have created a solution to sort of overcome one of the big humans' biggest healthcare challenges, but also created a new entry point into the healthcare system for people in need.
Thank you, Mats. Can I ask you some questions?
Absolutely.
So I think the question we had earlier, what were the reactions from robots from elders, was a very relevant one. What were the reactions when you took the robot and asked people to actually provide medical information, quite private information about themselves? Were there positive, negative? What was the feeling from people that used it?
Mainly, I would say positive. I mean, we had, of course, we saw first of all that the robot itself created a lot of excitement and triggered curiosity. And that sort of enabled us to sort of reach audiences that normally would not be engaged in let's say, a web or Instagram campaign in different ways. So we reach basically the people who are in need of this. Then, of course, there were different sort of reactions. Some sort of started their interaction from sort of 4 meters away, looking at the robot. Some thought it was really, really fun and sort of dove into it. But those are sort of very typical human reactions to new things. But we had also set it up in a way so that you could leave this information, sometimes quite private information, in a you're in a sort of small room, so no one can hear it, and you always have the option to put it in via the touch interface as well if you choose to.
And if you could choose, I mean, we have talked about this before, but what would be additional features that you would add to Petra to help tackle some of the health challenges around the world, if you could dream of it?
I mean, first of all, I mean, we need to sort of first look at the challenge putting this into the wild. We have been now into the semi-wild, so to say, testing in different ways, and you always learn that. And so we're excited seeing how does this work in a real pharmacy, in a real city, in let's say Latin America. But from there on, you also want to go into other types of markets. We have a lot of languages already basically prepared. That is sort of one thing. But then you can put on also these type of new types of sensors. But also, which is also very intriguing, is to see, we see now more and more of the healthcare is becoming digiphysical. You combine the physical experience with the digital element. And here it's also important. It's also very possible to immediately link you up to a doctor to sort of give you advice, or perhaps even help you treat your diabetes, or if there are also other diseases that are either very common but where the awareness is also very low, like hypothyroidism, which is also sort of 5% of the world's population has it, but perhaps 1/10 are actually getting the treatment for these problems. Or high blood pressure, that's like the #1 killer in the world. That's not COVID, that's cardiovascular disease. But also sort of linking in online doctors and access to different types of services like pharmacies and so on. So I mean, there are endless opportunities. So the Furhat robot and Petra, which stands for Prescreening Robotic Engaging Medical Screening, it sort of shortcuts this system and creates a new entry point and a new mobility for people to access health and to get treatment for that and help.
Mm. If we're looking at this project a bit more in detail, what were the the competences or the expertise that you had to provide from Merck, and what were the things that you didn't do? How did that work out in practice?
Basically, we started with the big medical challenge in this end. I mean, as a company, we want to use technology to benefit the humankind, and we believe that as a force for good. So we started with that together with our global franchises working with this, where it is a well-known problem that there are a lot of areas where there are huge needs. There are treatments available, medicines available since long time. They are very cost efficient, cost less than a chewing gum. But the challenge is how to get access, how to help people get diagnosed and get access to these treatments. So that was the starting point. So we started with a need. That's where the Digital Business Innovation Lab, where we're involved, that I'm responsible for to drive this validation. Okay, does this fly? Is it sort of worth to pursue? So we could quickly check the boxes and saw that, well, this is really actually interesting. Social robotics are relevant. But then we also got in other teams from our regulatory medical parts to look at, well, how do we sort of create a new type of experience where we sort of combined existing tools into a new interface, and that is very very interesting, and that created also a lot of excitement in the company for people to assess this, because as we could see, it's fantastic to see how this robot sort of changes personality and interacts with you. So regulatory, medical, marketing, and then also for the launch phases are different teams in the markets that we are now looking at. Latin America, then to everything then from country leadership to get priority for this, but also to sort of people on the ground actually implementing it together with our partners in the local market. And then of course Furhat was extremely helpful in this with working with the robot, and we could sort of connect our different teams to have a direct dialogue on how to create this experience. I mean, a lot of these validated questionnaires where you screen, they are made to be made on paper, and how to turn that into a vocal interface. That's sort of really easier said than done, but I believe in great teamwork with the Furhat folks and our medical teams globally, but also in the affiliate. That was a very smooth process.
Super. And maybe last question though. If there are other people on this webinar or who watches the recording later who are sitting in a big organization or company that is involved in healthcare, and they're curious to try out something with social robots, what would be your recommendation based on the learnings and experiences you have, which have been, as you say, fun and inspiring, but sometimes a bit challenging and unforeseen issues popping up?
I mean, I would sort of start and identify the key challenges that you have. I mean, the challenge working with this type of robot is that it's always seen as a sort of funny gadget. It creates a lot of attention. I mean, we have gotten media attention from on all 4 continents, Nikkei in Japan, CNN in the US, Reuters, Handelsblatt in Germany, and so on. But it's a value in that. But the key thing here is sort of identify and pinpoint the challenge that you want to solve in your specific context. And then sort of pursuing this from the angle of that, how can we sort of shortcut the system with this type of innovative technology for screening purposes. And then it moves beyond being a funny and engaging piece of technology that's something like a toy, which is not. I mean, it can really build new types of patient journeys and entry points into the healthcare system for people who need it. So yeah, so I would start with the challenge that you're aiming for, and start to sort of think a bit creatively. Okay, how would this sort of physical presence enable us to rethink the location, the point of integration where we do things, and how can we sort of rethink around that? And then I would basically, try it out. It's quite cost efficient to try something out with you guys, and play around a little bit, but serious play, where you put some time in, but you also learn a lot, and that stretches the mind and imagination.
Yeah, that's a very good piece of advice. So thank you for that, Mats, and thank you so much for joining us today.
Thank you.
I see that we have 2 minutes. I haven't seen any other questions so far, but if anyone has a last question before we say goodbye, there is still room for that. And otherwise, I'd like to thank you all for joining us today, for listening in. Hope that we were able to provide some inspiration. As I said, the topic is broad. We have merely scratched the surface, but we're looking forward to digging deeper with all of you out there and combining your expertise within your respective areas with our expertise on social robots. So I think with that said, let's wrap up for today. Have a great day whenever you're watching this, and looking forward to get in touch in the future. Bye, everyone.
Bye.